Did you know that according to the CDC, 1 in 3 Americans don't get enough sleep on a regular basis? Less than 7 hours of sleep per day is associated with an increased risk of developing a chronic condition such as obesity, diabetes, high blood pressure, heart disease, stroke, or frequent mental distress. Getting enough sleep at night not only helps avoid these conditions, but is also critical in humans' immune function, metabolism, memory, and learning in our daily lives. Today, I will be discussing how a sufficient night's rest is important to human health, and I will also be discussing the consequences of not getting a sufficient amount of sleep. Getting enough sleep at night helps humans think, improves our reflexes, and improves our ability to focus. When you don't get enough sleep, our ability to reason, problem solve, and pay attention to detail decreases drastically. Sleep has a direct impact on our mood. When we don't get enough sleep, we are more likely to be irritable and stressed throughout the day, which increases our likelihood of developing a mood disorder such as anxiety or depression. Getting enough sleep at night decreases that risk. Sleep not only plays a role on our mental health, but also our physical health. Sleep affects growth and stress hormones, appetite, blood pressure, cardiovascular health, and cardiovascular health as well. When you get better and more sleep, your body has more time to produce those hormones and prepare your body for the next day. Sleep also helps improve exercise performance. Studies show that athletes perform better when they get better sleep at night. Not only do they perform better, but it also helps improve their hand-eye coordination, reaction time, and the efficiency of the muscle recovery process. Some of the consequences of not getting enough sleep includes an effect on your mood. As I mentioned earlier, not getting enough sleep at night increases your likelihood of being irritable and developing a mood disorder such as anxiety or depression. While not getting enough sleep at night is not the sole cause of either one of these disorders, it can play a role in it, and good sleep at night is just one way to potentially prevent developing one of those disorders. Sleeping can also affect a person's appearance as well. A person can start developing wrinkles and dark circles underneath their eyes if they don't get enough sleep at night. While this is not necessarily detrimental to human health, it is not what most people would like to look like, and it will only show how tired you feel on the inside. Some of the physical effects are obesity, diabetes, high blood pressure, heart disease, stroke, and can even increase your chances of early mortality. Not getting enough sleep at night is just really hard on the body to function properly. While it is normal to have a restless night of rest every now and then, a person should consult their doctor if they're not getting good enough sleep at least one night per week, or if it is starting to affect their everyday life. Going to a doctor should be able to help you find out if there's an underlying cause. If your doctor can't figure it out, they can send you to a sleep specialist that can help diagnose conditions such as insomnia, sleep apnea, restless leg syndrome, and periodic limb movement, and a sleep specialist can help treat these. Once you're seeing a specialist, your sleep pattern should improve. I understand how living with a sleep disorder could be difficult, and help from your doctor should help. But if you don't have a disorder and you can't get good enough sleep at night, here are a few things you could do to help improve your sleep. You could get into a routine and wake up and go to sleep at the same time every day. This helps keep your body's circadian rhythm, or the internal clock that tells you when to wake up and go to sleep, in balance. Another thing you could do is limit your naps throughout the day to 15 to 20 minutes and only take them in the early afternoon, also to not disrupt your body's circadian rhythm. Another thing would be to avoid blue light 1 to 2 hours before you go to sleep at night. Another thing that could help you improve your sleep at night is being smart about what you consume throughout the day. Be conscious of substances such as caffeine, nicotine, and alcohol that you consume throughout the day or before bed. All could disturb your body's ability to sleep. In conclusion, getting an adequate amount of rest can provide a person with benefits and overall leave a person functioning at their highest potential. Lack of good sleep can leave a person with chronic negative effects and overall decrease a person's quality of life. My sources are cdc.gov, healthysleep.med.harvard.edu, newsandhealth.nih.org, schealth.org, health.clevelandclinic.org, mana.md, and helpguide.org.